we begin tonight with the new dietary guidelines and an updated food pyramid. Joining us tonight to talk about your health is Gage Blottenberger, registered dietitian at the University of Maryland, Baltimore, Washington Medical Center. Gage, thank you for joining us.
Thanks for having me.
Tell us about your work. I know you have a focus on women's health.
Yes. So I'm with a program called Healthy Pregnancies, Healthy Families, where our goal is we work with high-risk pregnancies, and our goal is to try and prevent gestational diabetes, resulting in further complications.
I want to come back to the details of that. You're also, by training, a chef, and your family has a food truck business.
Yes.
So wide range of experience.
Yes. Yep. Big culinary guy. So love to cook and love to eat.
Well, perfect segue to the new food pyramid from the USDA. And I always thought pyramids had the pointy side up, but this one is, I guess, an inverted pyramid. And you have everything on here. You have your fruits and veggies and some protein, some grains. What do you see when you look at this?
I think that it's great that, we're trying to promote whole foods, try to get away from the processed foods. I think it's great that we have frozen veggies, canned veggies at the top as well, promoting accessibility. I think the priority of protein is important. The recent guidelines were 0.8 grams per kilogram, which is the bare minimum to survive. So I think the updated guidelines of 1.1 to 1.5 grams per kilogram is a good update to help promote and sustain muscle. So I think it's great.
When you come back to your point about the frozen veggies, the canned veggies, is there a nutritional fall off? I mean, maybe the taste isn't as good as fresh, but this time of year, what are you going to do?
Yeah. No, actually, so frozen vegetables are actually harvested at their peak nutrition value. So you're not losing any nutritional value. Like you said, the taste might be a little different in consistency, but yeah, the nutrition's still there.
The other thing that stands out here is the carton of whole milk. From a nutritionist standpoint, do you care if people get their nutrients from skim milk or 1% or 2% or whole milk?
I think everyone's different, and I think your choice is the best. Whatever works for you. If your goal is to lose fat, lose weight, maybe go with the skim or 2%. If your goal is to gain weight or sustain, whole milk's a great option.
Right.
They'll provide great nutrients. So.
So many people focused on nutrition at the beginning of a year and put themselves under a lot of pressure. And I guess it's a good time to do it. You may have splurged a little bit over the holidays. For people now a couple weeks into the new year, give them a little emotional support to keep going.
Yeah, definitely. Like you said, emotional support's huge. So just having those people around you that are gonna be up there with you. And I think a big part, like you said, is it can be overwhelming. A lot of people set these goals that are, just very strict and cutting everything out. And I think that's where the sustainability part kind of loses. So I think setting small goals to achieve your overall goal is a great idea. I like to use SMART goals. A lot of dietitians do, and that's an acronym which stands for specific, measurable, achievable, realistic, and time sensitive. So a quick example would be, one of my goals is to run a half marathon by the end of the year. So specific, yes. Measurable, 1 year. Achievable, I believe so. Realistic, I think so. I've never ran a half marathon, so maybe setting something like a full marathon might not be realistic. And then time sensitive, so.
And I like the fact that you've now just told the entire state about it. So you put down a marker, which is another thing. It's like a commitment device that people do when you tell your friends, your relatives that, I'm going to stop smoking or whatever it is. It's an extra dose of commitment, maybe?
Definitely, I agree. And I think writing those goals out helps too. That way, as you go through your year, you can check them off. But I think the main thing is to, we want to create a sustainable, healthy lifestyle overall, not just eat a certain diet for a month or for the year. It's just, we want to create these little healthy habits to create something sustainable.
So give us some examples. What are some things that our viewers can do right now to maybe, even if it's a baby step, to improve their nutrition and by doing so improve their health?
So I would say building a strong foundation. So before you go out and get these supplements and cold plunge and do all these crazy things, let's focus on balancing your nutrition. Let's focus on sleep, and let's focus on movement. So your steps, your resistance training, those kind of things.
What does that well-balanced plate look like in your world?
So I usually refer to the 20 to 25 dietary guidelines of the MyPlate, which is going to be a quarter of your plate protein, a quarter starches, and then half non-starchy vegetables. Like I was saying, you can use it with everything. So I like to use pizza as a good example, because you have your cheese and your meat as your protein, you have your crust as your starch, and then let's fit in a side salad there to make it a balanced plate.
And one of the things we were talking about before is the impact of what you drink along with that meal. Your thoughts?
Yeah, I mean,
if you have a nice glass of water there, if I offered you a soda along with your slice of pizza and your salad, what would you do?
Well, I would stay with the water, but I loved soda in the past, and really I like to think of anything that we eat, if you think about it from a functional standpoint. So if we're going to have this soda, which has sugar, glucose in it, maybe let's drink it before we're going to go work out or go on a walk, so that we can use that glucose as energy and not, store it as fat.
People can be really hard on themselves, especially if they've set a goal at the end of last year, the beginning of this year. They find themselves falling short. What would your advice be in that situation where somebody's maybe fallen off the wagon a little bit, needs to get back on?
I think, like I mentioned before, just starting small. Don't overwhelm yourself. Set these little goals that you can achieve, and just try to be 1% better than yesterday, right?
It's a great line. Now, for people at risk of diabetes, it becomes a more serious situation. What rules should people in that situation follow?
So as I mentioned before, sleep is important. Having some kind of protein or fiber with your meals and snacks. I think, yeah. And movement, sorry.
All good. I wanted to come back to when we introduced you, focus on women's health, which is specific to high-risk pregnancies, women who are at risk of developing gestational diabetes. How does your program work?
So we enroll women we have 5 zip codes that we work with. And then we have a community health advocate on the team. So she helps with extra resources in the community. So access to food banks, assistance setting up WIC if you need that, diaper assistance, physical activity classes in the community. And then as a dietitian, I go over food safety in pregnancy, fluid intake, physical activity, balanced plates, snacks, that kind of thing.
What do you find works in terms of helping people stay motivated and stay on task?
I think just leveling with them, telling them that it's okay, they don't have to be perfect, and really just working with what they have. So a great example I like to use is ramen noodles. So if you take,
I don't see ramen noodles anywhere here on the food pyramid, right?
But a lot of my patients consume them, and so doing things like using half of the seasoning packet to reduce sodium, adding some kind of canned chicken or rotisserie chicken, and then some frozen veggies, then right there you've created a balanced plate.
And the appeal of the ramen noodles is the price, right?
Yeah, exactly.
How else can people economize, especially when you're pregnant, eating for 2?
So purchasing your meats in bulk. If that's too expensive, then go to the canned option like beans, quinoa, those kind of things. Buying produce in season is going to be cheaper, or like we talked about, go to the frozen or canned veggies.
So while you're preparing for your half marathon and you're eating healthy at every meal, does the dietitian ever slip up?
Definitely. Nutrition is about balance. So like I said before, thinking about ingredients functionally, and using them, such as, okay, let's say it's a hot day and I worked out and I'm outside running and I'm sweaty. Potato chips, great option because they have sodium, potassium, so you have your electrolytes there, and then pair it with a protein for a balanced post-exercise snack.
All right, you can come back. You've recommended potato chips. It's Gage Blottenberger with University of Maryland, Baltimore, Washington Medical Center. Appreciate your time. Thanks very much.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.